You are listening to the Horse Radio Network, part of the Equine Network family.
Greetings, everyone. Coach Jen here, and thanks for tuning in to Horse Tip Daily, episode 1558. Today, it's all about keeping your horse's joints healthy. And I am so happy to welcome to the podcast Dr. Cowles, who is the Managing Veterinarian Equine Technical Services with Zoetis. And that's a really big mouthful. Welcome to the show, Dr. Cowles.
Thank you, and I'm glad to be here.
The folks at Zoetis reached out to me recently and mentioned that they had done some really interesting research on how we can help keep our horses' joints healthier longer. And we're all interested in that. And a lot of it centered around something called Synovitis. So we're going to start out with what is Synovitis, and am I even pronouncing that correctly?
Yeah, and the way we pronounce it is Synovitis, so very close along that line. But this is a common condition in athletes, not just horses, but athletes in general that run around, jump, perform, just that constant motion creates tension or inflammation in the joint. And our body system normally balances that out. When we get the synovitis is when it's out of balance and the synovium that covers those joints is inflamed.
So it's essentially inflammation within the joint. Is that right? Am I getting that right?
The capsule that surrounds the joint. That's
so that surrounds the joint. Okay.
Yeah, the capsule that surrounds the joint. And then that gets inflamed and that creates things that cause other problems within the joint.
Okay. So synovitis, now I'm pronouncing it correctly, is something that's going to lead to other things that we don't want to see down the road. So how do you even know if your horse has synovitis?
Usually it's what you see is that you'll see a little swelling in the joint. So around that joint, that pocket fills up with fluid and that synovitis causes inflammation. And so you see a little swelling. You might see pain on palpation, sometimes a little redness or heat that you'll feel in the joint. And that can be all synovitis, that early process that's starting to happen.
So if I have, and seeing as how this involves joints, this is swelling that we're going to see around joints. We're going to have some heat. Yep. So early on in the early stages of synovitis, is there always lameness present, or does it start early and as it gets worse, that's when we start to see the lameness happen?
Right. So sometimes it can be just off a little bit, but it's hard to see the lameness. They're just not riding right under saddle. Other times they will have lameness and you can see it associated with this. So it's kind of a varying scale depending on which joint it's in and the severity of it. But we do normally use like the AEP lameness scale of 0 to 5 and trying to pick out how severe it is for whichever joint is involved.
All righty. So synovitis is not a new thing. It's been around since horses were around. What is the most traditional in the past we've treated? How do we treat synovitis?
Yeah, in the past, the main treatment that we used was corticosteroids or hyaluronic acid, or some people would just use cold water therapy and rest. But for the most part, it was been using steroids in the joint to quiet it down and remove the pain and the swelling that was associated with it so the horse could go back to work. So
Zoetis got into their little heads that we need to have a better treatment system. Why a better one? Why wasn't corticosteroids the be-all to end-all?
Right, because we learned over time that repeat usage of corticosteroids created other problems long-term in the joint, that it helped a little bit, but then chronic use of it caused degradation of the joint. And there's a population of horses that may have metabolic disease. Some of you may like Cushing's disease, PPID, insulin resistance are a few of them that potentially giving corticosteroids to would instigate a laminitis case. That wasn't in all things, but it had that potential. So we wanted to look to see if we could find alternatives to corticosteroids that wouldn't have those side effects.
There we go. That sounds like a brilliant idea. So now we are going to move on to another big word that I'm probably going to pronounce incorrectly, and I'm sure you'll correct me if I'm wrong. Autologous protein solutions, or APS. What is it, and how is it going to help our horses with synovitis?
Yes, it's autologous protein solution called APS, and it's ProStride APS device that Zoetis has. In this process that you harvest the horse's own blood and take the natural healing abilities of the plasma, the white blood cells, the platelets that are in blood, and you're able to concentrate them, inject them back into an inflamed joint to help quiet it down and bring it back into balance. So you get rid of that lameness, that inflammation, some of the side effects that may be associated with that synovitis that is happening.
So is this something that has to happen at a veterinary clinic? Are there only certain specialty vets or universities can do this? It sounds pretty darn high tech.
It is, but only your veterinarian can do this. And they've got the equipment and the expertise to take a look and process the blood and make sure it's sterile to be able to put that back into the joint. And plus, they're also the ones going to help you determine which joint is most affected and needs that treatment, where it's lame at, where this is happening. You know, they're going to do that evaluation to make sure we're treating the right joint or the right problem.
Well, that's true, because oftentimes when our horses have lameness issues, it's not just his right hock hurts. There's compensatory things going on. So there's a lot going on. So it's very, very important to have your regular vet who knows you and your horse well to help you with this process. Correct. Are there joints that are more commonly treated with this, or not commonly, or shouldn't be treated with APS?
So almost any joint can be treated with APS that's in the horse, especially if it has a joint capsule, which is usually looking at our stifle, hip, down the leg on the back end, shoulders, and things like that, the lower limb.
Shoulders, really?
And that process can also be treated because they have a joint capsule. We don't have a lot of data on treating spines, just the vertebrae in those types of situations at this point, because they don't have a joint capsule. We have a lot of experience in joints that have a joint capsule to where the injection can be held within that joint to have its effect. And that's kind of critical for this whole process, is to make sure that there's a capsule that holds what you inject into the area to have its influence on the environment to correct it.
There we go. So corticosteroids, we know, injecting them into joints that have synovitis, long-term has some drawbacks. This is a relatively new technology. Do we have any data on how often is appropriate for the horses to be treated with autologous protein solution?
Yeah, so orthobiologics have been around for a long time. So APS has been on the market for almost 10 years going through this process. So they're not really new. It's just that research is catching up with some of them from that aspect of things. So we have quite a bit of research around where we're using, what we're doing. What can you expect for longevity? That's a good question, because it depends on the severity of the synovitis or the OA in a joint, the use of the horse, the age of the horse, what's going on, and other factors that may be involved in that joint. But usually is what we say is that you'll get the same amount of time that you got with the steroid, maybe even longer. But there's a lot of variabilities that influence how long this is going to last.
And after all this, I'm going to ask, what kind of research have you guys done with this? There's got to be a lot of science.
Yeah, we support quite a bit of research at the university. We did a synovitis study at the University of Penn. And in that study, it showed that APS or ProStride APS device actually made the joints look more normal as compared to an inflamed joint or a control joint that had synovitis. So on the cartridge surface and the synovium, it looked normal versus having the inflammation and problems associated with it. And that's where we learned about the benefit of this ProStride product.
There we go. And if we want to learn more about this science, how it works for our horses, where can we go online to get some really good quality information?
Yeah, we've got a few web pages that you can go on and get more information. We have a horse owner website. It's at zoetisequine.com, and you can go on there and take a look at all of our products, but also there's a section for the regenerative medicine, and you can learn more about it there. talk to your vet about it as well and options that are available.
There we go. And as usual, we will have those links on the show notes page for this episode of the podcast. And thank you very much, Dr. Cowles, for stopping by and explaining to us and in helping me pronounce these things properly.
Yeah, no problem. Enjoyed it. And if you've got any other questions, just let us know.
For first-time horse owners and new riders, finding the information and support you need can be challenging. That's why Equine Network has partnered with Sentinel and Absorbine to bring you My New Horse. From important horsekeeping information and how-to videos to social media communities, exclusive experiences, and more, My New Horse is your one-stop shop for riders of all levels and disciplines looking for easy-to-understand horse care information and guidance. Start your horse ownership journey today. Visit mynewhorse.com.
Well, there you have it. Horse Radio Network has thousands of engaging podcasts for horse people, and you can have them sent right to your phone. Just subscribe via your favorite podcast player. This is Coach Jen, and I will be back again soon with another tip. Until then, go ride your horse. The Horse Radio Network and the Horse Radio Network hosts are not responsible for statements made by guests on the Horse Tip Daily. Please use your own judgment when listening to the tips on this show.